All right, so we finally made it to your surgery day. Now what do we expect? So whether your surgery is at the hospital or the surgery center, you'll be asked to arrive about 2 hours before your actual surgery time. During that time, they'll get you registered, they'll get you into the pre-op area, start your IV, get you your pre-op med, chance to talk to whoever your anesthesiologist is, and then you'll also have a chance to talk to Dr. Frisch prior to your surgery. Time for the actual surgery, they'll wheel you back into the OR. They'll do your anesthesia, whether that's a spinal or a general, which you'll discuss prior to that in pre-op. Then the surgery itself takes about an hour for a primary. If you're having a revision done, it could take a little bit longer, usually around 2 hours for a revision. Once your surgery is completed, they will wake you back up and they will send you to the recovery area. In the recovery area, once you are awake and feeling okay, they will make sure that you can drink something. You need to be tolerating liquids before you can go home. And they'll also make sure that you can get up and move around safely before they send you home. You can expect to be in the recovery area for about an hour or two. So roughly, you can expect to be at the hospital or the surgery center for about 5 to 6 hours on surgery day.